Bonjour à toutes et à tous. Je me présente, je suis Lola Koubessi, professeure adjointe au département de psychopédagogie de l'Université de Montréal et je co-dirige avec ma collègue Mélissa Bissonnet de l'UQAM le Pôle sur l'éducation inclusive du Centre de recherche interuniversitaire sur la formation et la profession enseignante CRIFPE. Donc aujourd'hui, puis dans le cadre des activités du Pôle, nous avons le plaisir d'accueillir avec nous Dr Rafiath Rashid. Sa présentation s'intitule The Double Shadow Inclusion for Young Children in the Global South. So, avant d'introduire notre conférencière, juste quelques consignes. Disons, la présentation, ça va durer 30-35 minutes, puis elle est précédée par une période de questions de 15 à 20 minutes. Et puis cette période est animée par Gabrielle Montesano, doctorante à l'UDAM et membre étudiant du CRIFPE. Et donc, nous vous invitons à écrire vos questions en anglais ou en français, parce que la présentation est en anglais, dans l'icône questions et réponses. So, good morning, good evening, good afternoon, depending where you are, everyone. Thank you for joining us today for this webinar organized by CRIFPE. So, we're very excited to welcome Dr. Rafiath Rashid. Dr. Rafiath is a seasoned development professional with 17 years of experience in the education sector. With a PhD in early childhood education, she brings extensive expertise in project design, implementation, and research in the Global South. Currently, she's working as the head of early childhood development and education program at BRAC International, one of the largest development organizations in the Global South. As I mentioned before, the presentation is titled The Double Shadow Inclusion for Young Children in the Global South. So Dr. Rafiath will speak for approximately 30 minutes, followed by a 20-minute Q&A session. This session will be moderated by Gabrielle Montesano, a PhD candidate at Université de Montréal. And during the presentation, so you can write your questions either in French or English in the Q&A box, and we'll address them during the discussion. Dr. Rafiath, thank you again for accepting the invitation. The floor is yours, and you can share your presentation.
Thank you so much, Rola. Thanks for the introduction. Good morning, good afternoon, good evening. From my side, it's good morning. As Rola has introduced myself, I am Rafiath. I'm working currently at BRAC International, and I have a long, professional experience of working in the Global South. I focus on early years education primarily, but of course, inclusion of children with disability in particular, it's not very separate from what I do and where I work. And I also have experience of working in the refugee context, both in Bangladesh and Ugandan refugee context. And in today's presentation, I'm going to focus on these two countries from the Global South, and particularly will focus on the refugee context. So let me share my presentation. As Rola has already mentioned that the title of my presentation, it's The Double Shadow, Inclusion of Young Children in the Global South. And why I have put the double shadow in the title, I think we can already understand that from how I have started, my introduction, and I'm going to reflect a little bit more on this when I start. And then from the Global South, as I have already mentioned, that I'm going to focus on two countries, Uganda and Bangladesh. Sorry, this. I'm going to walk you through today's presentation and what I'm going to talk about today. I'm going to, first of all, I'm going to reflect a little bit on the global inclusion gap. And then I'm going to focus on two countries, the Uganda and Bangladesh context. And I'm going to share some of the data, which are mainly the secondary data from UNHCR and UNICEF documents and the country plans. From there, I'm going to share some of the data to understand the situation of inclusion in these contexts. And then I'm going to share comparative analysis between these two contexts. I'm also going to reflect on the finance and budget issues in our workspace, especially for disability inclusion. After that, I'm going to reflect a little bit on why it is important to protect the foundational years, as this is my core area of interest, working for young children. And then towards at the end, I'm going to just share a call to action and why we need to move from access to meaningful participation for children with disabilities. And at the end, of course, there will be room for question and answer. So the global inclusion gap, particularly I'm going to focus on the global south. When I thought about the title of my presentation, I thought about double shadow because, of course, it's children with disability. It's supporting children with disability, and it's a big issue in itself. And there are lots of challenges around that. But when there is this intersection of the refugee crisis, the humanitarian crisis, then the challenge becomes even more severe for countries who have to face this. Nowadays, globally, and particularly in the global south, we are at the intersection of displacement, disability, and developmental windows. And these are the three things that you will see that it's coming again and again throughout this presentation. How these intersectionalities of young children, particularly children with disabilities, and particularly children with disabilities living in the refugee crisis, how it becomes the situation even more difficult for those children. According to the UNHCR report, of the 12.4 million school-aged refugee children globally, 46%, almost half, are out of school. And for those with disabilities, the numbers are more severe. Here, one thing I would like to highlight is that sometimes lack of data is a big issue, particularly for children with disabilities. If they are not in the school system, it's even more difficult to find that data. And children with disabilities are 49% more likely to have never attended school compared to their non-disabled peers. And it's not a surprise for us, because often children with disabilities are invisible. They, as I have just mentioned, that the data don't speak for them. Sometimes there is no intentional initiative to identify and support children with disabilities, particularly in the global south, where countries are dealing with so many crises, economic crisis, refugee crisis, a lot of crises. There, prioritizing the needs for the children with disabilities is a big issue. According to the UNESCO Global Education Monitoring Report, it found a 10% gap in primary completion between students with and without disabilities across 51 countries. So it's a global issue that not only identifying and bringing them in, bringing the children with disability in the schooling system, but also helping them to progress, also helping them to move forward and complete their level of education. So there is also a big gap in that regard. The funding cliff, and this will come throughout my presentation, like how funding is a big issue, especially for underdeveloped or developing countries, where there are other competing priorities, like health, the poverty, and some of the basic needs for young children. And historically, education receives less than 3% of the humanitarian humanitarian aid, particularly when we are talking about the humanitarian context. Education is not sometimes the high priority compared to the other issues that the refugees have to face. And in 2025, UNICEF reported an acute funding crisis in Bangladesh, placing education of 230,000 children at immediate risk. And when I'm going to share the data of both Uganda and Bangladesh, you'll see that how this, the global funding cliff is actually affecting the children who are living in a refugee context, particularly those who are living with disabilities. Now I am going to move towards Uganda. And Uganda is facing a challenge or dilemma, I would say, between integration and implementation. Uganda hosts over 1.94 million refugees, and 63% of them are children. And these refugees are coming mainly from South Sudan and DRC, the Democratic Republic of Congo. But there are also, from other countries, from Eritrea, Burundi, refugees are coming to Uganda, and it's hosting Africa's largest refugee population mainly because it has an open door policy where refugees are not considered as outsider. They are welcome and they are integrated into the national system with the belief that they will be the future contributors in Ugandan national economy. Now, the Ugandan constitution, aligned with that, open door policy, Ugandan constitution and the Refugee Act grant refugees the right to education on the same basis as nationals. So when refugees are coming to Uganda from South Sudan or any other countries, they can actually get enrolled in the national education system. And under the Comprehensive Refugee Response Framework, refugees are integrated into the national district education systems rather than being kept in the camp-based schools. While Uganda is considered a global leader in the inclusion of refugees in the national system, the quality of inclusion for children with disability is a major challenge. And there are also further challenges because there are influx of refugees. It depends. It varies from year to year. Every year, there might, if this year it may look consistent, but the other year, the next year, there might be an influx because of the volatile and fragile political situation in the neighboring countries, particularly South Sudan and Congo, where a major conflict happens every couple of years, every 2-3 years, and there's a massive surge of refugees at that time. For example, a massive surge of new arrivals from Sudan and DRC in late 2025 has overwhelmed and as I have mentioned, that more than half of the refugees are actually children. So it has overwhelmed the schools, the other systems and infrastructure, those are available in the refugee camps. There are a few issues I would like to highlight from the Ugandan refugee context. Enrollment versus support. Yes, there are a large number of children with disabilities who are enrolled in the education system in Uganda. However, only very little percentage of them, they receive any kind of assistive devices. And here you can see the data is only for when we are talking about assistive devices, it's the kind of disabilities, those are visible. For example, the children with physical disability or hearing impairment. But there are also learning disabilities, intellectual disabilities, and other kinds of disabilities, and data for those are not widely available. Lack of services for young children. Yes, young children, particularly children with disabilities, including them in the early education system is very important for early identification. But overall enrollment of pre-primary education stands at only 34% in the context, where resources are diverted to primary and emergency health needs. There are other competing priorities in a refugee context, as I've mentioned before. The caregiver crisis or trained workforce crisis is a big crisis because many a times, it is dependent on external funding. And therefore, when there is a huge fund cut, sometimes the trained staffs, caregivers, who have been trained in to provide inclusive support, they are let go. They lose their job, or these children become completely supportless. There's also the issue of high teacher-student ratio. As I have given an example of how in 2025 there's a massive surge of refugees from Sudan and Congo in Uganda, and it suddenly spikes the teacher-student ratio because there is lack of trained teachers or staff, trained caregivers. At the same time, a high influx of children coming in. So in that environment, children with neurodivergent needs are effectively invisible. Now I'm going to reflect on Bangladesh. Bangladesh is has a contrasting picture in some cases, but there are also similarities in some cases. Bangladesh has parallel system, and I'm going to discuss what that looks like. In Bangladesh, the national context for nearly 1.2 million Rohingya refugees, and again, more than 50% of them, more than half of them are children, is defined by a policy of non-integration. Unlike Uganda, Bangladesh does not have an open door policy for refugees. Bangladesh is not a signatory of 1951 Refugee Convention, and therefore the Rohingya presence in Bangladesh is strictly temporary, and it causes a lot of other issues because they don't have a policy of integration. Young children, particularly children between 3 to 8 and further, they are prohibited from enrolling in the national school system. So the children are being educated, or they have access to the temporary learning centers within the camps. And these temporary learning centers, it is only up to primary. And after that, either children have to go to vocational education or some kind of life skills based activities because they cannot go into the national school system. So it's a major, major challenge. But there has been some changes. There has been some formal adoption of the Myanmar curriculum, which is taught in Burmese in the camp context, so that the government realized that these children, they have the right to education, and some sort of initiatives are being taken through these learning centers. But beyond that, there is lack of long-term sustainability of educational access for these children. And by 2026, international funding for this parallel system had collapsed. It's not only, of course, we all are aware of, the US funding cuts, but globally there is funding cut. And now, less funding is going into a context, particularly like Uganda, Bangladesh, where refugees are there for a long, long time. And so Bangladesh government, in recent time, they have approved state funding to reopen some of the learning centers which have been closed due to funding cuts in 2025. However, this is still, a temporary solution, a small effort in the big crisis. So, in the Rohingya camps of Cox's Bazar, again, children with disabilities face a triple barrier, I would say. And first of all, the policy restriction is there. Secondly, even the geography, the locations, and the terrain is not friendly for children with disabilities. And of course, again and again, the same issue of funding collapse is coming in, and that has a huge impact. I'm highlighting three main challenges or issues here, which are very recent. I mean, it has been ongoing, but recently related to young children, particularly children with disabilities, I think these three issues are very important for us to reflect. First of all, the young children are not getting the services or provisions which are needed for them. And, due to funding cut, a lot of learning centers have been closed, displacing almost 300,000 children. The volunteers, teachers, or caregivers supporting kindergarten to grade 2, they lost their job due to US funding. So this situation is, it's a very difficult situation right now. And of course, systemic exclusion is there. It's a challenge. The National Survey on Persons with Disability revealed 60% of children with disability in Bangladesh are not in education system. This is a national survey, not only this does not only speak for the refugee context. And in the camps, this is exacerbated by the closed door policy that prevents refugees from accessing the national systems. Because in the national systems, of course, there are some measures taken to include children with disability, which the temporary learning centers in the camps may or may not have. But when the national picture is that, the 60% of children with disability are not in the school system, it's more than half, then of course we can imagine how the situation is in the refugee context. Topography and access. As I have mentioned before, that the geography is a challenge. 15% of children with disabilities in these camps, the situation is very, very difficult because there is lack of basic services. There is physical barrier to access because of the hilly terrains. The terrain where the camps are situated, it's hilly. It's not. I would say it's not a flat geography like where they came from, but also building these learning centers is a challenge, and accessing those learning centers for children with physical disability is a major issue, where there is lack of assistive devices for access. And there are also other issues related to disasters. There are flooding, cyclones, because it's situated by the Bay of Bengal, and the geographic is as such that it is very much disaster prone. So, and there the most challenging situation is faced by the children with disabilities. Now, if I compare the situation in two countries, one is situated in South Asia and the other is in sub-Saharan Africa. Well, Bangladesh is not a signatory of the Refugee Act, while Uganda is. And therefore, Bangladesh has a parallel and segregated camp-based system where national integration is prohibited. And Uganda has an open door policy, a friendly environment, comparatively friendly environment for refugees. Bangladesh has recently started adapting the Myanmar national curriculum because the Rohingya refugees are coming from Myanmar, and adapting to the local language. But then again, it's restricted to a certain years of education. Uganda has national access to national system, which is a good thing. But funding issue is quite similar in both of these contexts. And when we are looking at the issue of children with disability, it's sort of similar, although policies are different. But when it comes to, as you can see, that the total education appeal is for Bangladesh and Uganda, because Uganda has this integrated system. It's really high in Uganda, but it's also in Bangladesh. This is the education appeal. And disability specific funding is very, very low. I mean, compared to the number of millions of refugees are there, and more than 50% are children. There, disability specific funding is almost negligible. Again, for the assistive devices or technologies, Uganda has some investment, while Bangladesh is again negligible, and a lot of it may be caused by the policy issues and of course the fund cut. Primary funding sources: Uganda has the domestic revenue, because since it's an open door policy, government has a budget line, and they have a mandate to invest in the refugee crisis. So they do have some budget, but it's still heavily dependent on external donor funding from World Bank, GPE, or other funders. Same with Bangladesh. Bangladesh is absolutely dependent on donor funding. There are some budget coming from the government, which is again, supported by World Bank, but it's heavily dependent on donor funding. Budget trend, again, it's the same. I'm not going to go into detail. You can see that it's a very challenging situation. Staff, and it is related to the trained finding and identifying, training caregivers, volunteers in the refugee context, particularly for disability inclusion. It requires investment, and without funding, it's not a reality. Okay, so far I have discussed about the situation in the refugee context, the situation of children in the refugee context, and situation of children, particularly for children with disability, and why we need to focus on foundational years. This is very important because, first of all, the cognitive readiness is very important. Disability inclusion should start as early as possible, starting from 0 to 3-year-old, with nutrition, with health screening, so that the support can be provided as soon as possible. And 50% of children in Uganda are stunted. So there's also malnutrition is a big issue, which is even worsening the situation for children with disability. Mental health is a big challenge. Mental health in the refugee context, since these children come through a lot of trauma, they are displaced, their families go through a lot of trauma. So it's a big challenge, and how to address that. In Bangladesh, I just thought that it should be important to highlight that abduction is very high. Only in the first quarter of 2025, 51 children got abducted, and that also creates a fear of, an atmosphere of fear, and particularly this has an impact for children with disabilities, and that's why I wanted to highlight it here, that in this situation where safety security is a big concern, because they live in a restricted area, safety security is a very big concern, and this is the main reason sometimes parents don't allow children with disability to come out of the house or go outside. The cost of inaction is very, very high. The lack of mobility aid, for example, I'm just giving one example, that it leads to a lot of complications, which cost the host country health system 3 times more than the initial device cost. So even as the inaction to provide assistive devices has a lot of cost related to it. The inaction for investing in younger children has a lot of cost in the longer term. And this is something that we all need to reflect on and highlight and advocate for. And there are evidences available that says that inclusive play-based learning in the first 6 weeks increases attendance by 30% for children with disability. So if there are child-friendly play-based environment created for children with disability, their attendance increases, and and then there are, of course, the other interventions for their learning support, their support for assistive devices. If those can be ensured, then they can actually move forward and realize their own potential. Last but not the least, I think we all should think about moving from access to meaningful participation, and we need to advocate for this to the respective governments, to the global community, and there should be more investment in research. And there are already plenty of evidences available globally for disability inclusion, and there are also a lot of research going on the refugee context. But then again, the cost of inaction is very high, and that's why more advocacy is required. Funding the last mile is very important. Again, this evidence has been taken, this data has been taken from a research that every $1 in assistive tech yields $9 return in reduced dependency. And this return is generated, reduce future dependency, lower long-term healthcare cost, and child's eventual entry into the labor market. So there are a lot of cost related to the inaction that we need to identify, calculate, and advocate for. The focus on young children is very important, because by investing in the first 8 years, we provide cognitive emotional protective shield, along with early detection and support for children with disabilities necessary to turn a history of trauma into a future of resilience and independence. We need to invest more in creating workforce, training workforce, particularly in the refugee context, training volunteers and caregivers to support children with disability, and focus on reducing the child to teacher ratio, particularly in the learning centers or in the schools. Policy shift is very, very important. The host nations, they should legalize inclusive early education as a compulsory measure, because there are a lot of issues related to primary education and particularly for those countries who are hosting the refugees, but at the same time they have a policy of non-integration like Bangladesh. In those cases, how we can ensure ensure the right to education for these refugee children, particularly those with disabilities. And these children with disabilities are sometimes absolutely invisible from the system, from the society, from the community. And I have given a lot of evidence, I think, throughout this presentation why they are invisible. And it's time that it's not time, I would say it's late, and we need to speed up and do a lot of advocacy, create a lot of evidences for including children with disability, particularly when they are affected by the intersection of humanitarian crises, poverty, and other challenges. Thank you. I don't know whether I have finished early.
Thank you so much, Dr. Rafiath, for this rich and insightful presentation. It gives us a great deal to reflect on. Yes, we're on time. We have about 20-25 minutes for questions. So what I will do is I'm going to read them out loud to you. So I'm just going to say it in French as well to make sure that everybody understands. Vous pouvez écrire vos questions dans la section Q et R. Je vais les lire à voix haute à Dr. Rafiath. Donc, si vous voulez les écrire en français, il n'y a pas de souci, je vais pouvoir les traduire. Sinon, vous pouvez les écrire directement en anglais. So So I invite you to write your questions in the Q&R section, and I will read them out loud. So we'll start with the first one. We have here a question. Someone is asking, what does developmental window mean? I may have missed the clarification at the beginning of your talk.
Yeah, absolutely. I'm happy to explain that. The developmental window means that when we are talking about, particularly in the context of my presentation or what I was discussing about, it means the foundational years for children, particularly the first 5 to 8 years when brain development happens rapidly, and it's the right time to support children with disabilities, and that's the developmental window that I was referring to. That's when the rapid brain development happens, and rapid neuron connections are built. So for children with disability, it's important that they are early detection and early intervention during that first few years of developmental window.
We have a comment. The person says the policy shift advocated makes sense, but the burden on host nations seems high. I don't know if you want to react to it.
It is true. The burden on the host nations are high because these host nations are also, they are also, they're not like rich countries, or they are developing countries. They also have their own challenges, their economic priorities, their other social challenges, and on top of it, they're hosting a large number of refugees. And of course, the burden is enormous. But at the same time, we need to realize, as a global community, it's not only on the host countries, and that's why a lot of it I have presented that it's the burden. It's very much donor dependent. A lot of funders are funding, and when there is no funding, suddenly a huge reduction in trained staff, in learning centers being closed. So as a global community, we need to ask ourselves how we should position and how we should support these children. These children are they have the right to education. They have the right to be integrated. They have the right to safety, for basic, they have their basic rights, and how we ensure human rights for these young children who are displaced from their home. I understand that the burden is there's a lot of burden on the host countries, and they probably only can do so much. But the purpose of my presentation was not to highlight that the inaction for host communities, but the inaction as a global community, particularly the donors and funders, and how they shift their priorities from one thing to the other.
Mm-hmm. Thank you. We have another question. What about teachers who teach to refugee students? Do you have any data on their training, living conditions, professional situations? Do you know if there are local educational initiatives to address these barriers?
So from my experience, I don't have the data with me right now, but I can tell you from my experience, because I have worked in both of these contexts. The teachers are mainly coming from the refugee context, or the host communities, the nearby host communities. So at times, but particularly in the learning centers, there's a combination. Like sometimes there are two teachers, one coming from the Rohingya family, another coming from a Bangladeshi host community. Same for Uganda. There's might be in a classroom where there is most of the student coming from South Sudan. There's one South Sudanese teacher and one Ugandan teacher, because of language adaptation, a lot of issues, and so that the children can cope in the new environment. So sometimes this strategy is used. So yes, the teachers are, for early years in particular, the teachers are coming from those communities, either the host or the refugee communities. And then government or other partners, they train these teachers. So it's, of course, there are data in terms of, there are public schools like in Uganda, there are government primary schools, but ECD or pre-primary is mainly implemented by partners, by NGOs and other partners. So, and they have data. Like if you go to the UNHCR data for Uganda, the Office of Prime Minister is responsible for that. You'll find the data of how many teachers are there, and that includes government teachers as well as teachers coming from the communities. You'll also find the same, like in the refugee camps, these data are available. Sometimes the data that is missing is for the children with disability, unfortunately.
There's somebody else that wrote a comment. In some of these nations, the ratio of regular pre-primary education is quite low, let alone for children with disabilities. If you wanted to react.
It is true. Mm-hmm. Yes, I have already shared that in Uganda, the enrollment rate is around 30% for pre-primary, because government does not provide universal pre-primary education in Uganda. In Bangladesh, it's a little better, particularly in the past decade, where Bangladesh government has taken the responsibility of 1 year pre-primary for 5 to 6 year old children, which is provided by the government. But as a whole, yes, the enrollment rate is still very low for early years.
Somebody else asks, is this a trend we can observe in other global South countries?
I mean, the trend for the enrollment for early years, or just the overall refugee context?
I don't know if the person would like, the trend for refugee context.
I mean, this is the current situation. At least I can speak for Uganda and Bangladesh, and I am pretty sure that, there are, and many global South countries are now hosting refugees, and the situation is not very different. Some of them have open door policy, some of them have this temporary status policy, but it does not matter. It's still heavily dependent on external funding, and the refugee crisis, it's a global crisis. We all know why it is happening, where it is happening. So, and we don't want it to be a trend, but it looks like it is.
The same person is asking, would it be possible to achieve a global coalition around this issue, and how would it look like?
Well, there are global coalitions available. Well, the Global Refugee Forum is working with many countries, and there are all the countries around the world who are hosting refugees. They are pledging there. It's a different story whether those pledges are, those pledges are being tracked, but how much is being achieved, that's an issue. Sometimes there are commitments, but no realization of those commitments. It's not that the coalitions are not there, it's there. A lot of them, it's more important to make them accountable, to track the progress. And I mean, there are accountabilities at different stages, accountabilities of global communities, accountabilities of the host countries, accountabilities for, for the countries who are creating the situation of this refugee crisis. So, yes.
I'd have a question. You mentioned in one of your slides that trauma could be viewed as a disability. Do you include all this trauma that children with refugee backgrounds go through throughout their trajectory? Is it something that's included when you talk about children with disabilities?
Well, it's not, but sometimes if you go to the communities and if you really want to identify children with disabilities, and these children suffering from trauma, long-term trauma, can manifest, some some of them they stop speaking. Some of them they start being violent. So all of those things are considered as mental disability at some point or somewhere in the spectrum. So there is a fine line, I would say.
Another question we have is, you mentioned the importance of research in this context. Could you elaborate how research can benefit these affected populations? How can it help the population? The challenge here is that funding is part of this industry of funding in crisis situations that doesn't serve the population necessarily.
True, and while I'm saying that research is important, I must acknowledge that there is a lot of research and evidence already available. The cost now, a lot of discussion is moving into like the economic return of inaction, right? Or the ROI, that kind of using those economic terms have become more important to see. Like if you invest in our refugee children, and it will give you this much of economic benefit. And it's important, and to some extent, because Uganda, who have an open door policy, they see their refugees contributing to Ugandan economy. So in those cases, of course, those kind of evidence is important. So that, and of course, strong advocacy with the government so that they invest on refugee children, on the education of refugee and skill development of refugee children. And there are studies for children with disability. The situation, a lot of it is still unknown. I would say there's a lot of scope to learn more about. And there are contextual variation in terms of how disability is defined at times. Like I have said, like trauma can also be translated into disability. It depends on there are some contextual variation, and there are contextually adapted support required. And it's important to explore those. And really ethnographic studies, understanding what's affecting a decision of a parent for not including or not including a child with disability. What's the aspiration? What's the plan? So yes, I mean, when I'm talking about creating more evidence, it's that. And a lot is also we create evidence, especially in a social context, to be able to advocate with those evidence to the people in who have the authority and the power and the financial capability.
Mm-hmm. I find it very interesting to highlight both contexts. One context that has an open door policy, and another one that it hasn't signed the convention yet. I was wondering, when we talk about an open door policy, does it come with structural educational support, with psychological support? We want refugees to be part of the population, to give back to the economy, but is there more of an we talk about integration, but in what sense is there support given more so than in the Bangladesh context?
So when we're talking about integration, like children from South Sudan can come to Uganda and they can get into a public school system, and then they can be assimilated with the national system. So it's when we are talking about integrating and creating opportunities, incorporating mental health and psychosocial support, we also need to understand the capacity of the host countries to do that. I mean, the host countries are not even being able to implement, social emotional learning or mental health and psychosocial support in their own school system. So it's not there. But it's important for refugee children, and it's mostly driven by external partners. It's not NGOs and CBOs. They are implementing those kind of models. So it's not always integrated in the national system, but at least they can get into these children and come, and they can get the healthcare support. They can get into the education system and study in Ugandan public schools, and then move forward. While in contrast, in Bangladesh, they cannot even get enrolled in a Bangladeshi school, or so it's the expectation is that at some point they will go back, but nobody knows when.
Somebody has written, I'm impressed by what Uganda has been doing despite the challenges and shortcomings you discussed.
Yes, I think Uganda, as I have mentioned in my presentation, that one of the largest refugee hosting country with an open door policy. And because most of the countries surrounding Uganda, they are in some sort of crisis and conflict. So yes, it is impressive, but at the same time, Uganda as a country is still, it's a developing country. It is, in large extent, it is donor dependent on external funding. They're struggling with their own economic realities. And at the same time, it's sometimes difficult to focus on the refugee population. And that's why, this external dependency create a lot of uncertainty for the refugee population as well.
Mm-hmm, mm-hmm. Another question is, in the context of Bangladesh, despite the non-inclusion of refugee children, and doubly so with those that have disabilities, how can it increase donations, and are they interested in increasing options for refugee children?
Bangladesh government is taking some actions. They are investing because due to the huge funding cut, the closure of USAID and the US fund cut, a large number of about 300,000 children have been out of the learning centers or out of education system. Those were established by different partners and as well as government. So that's why government has decided that this year they are going to invest from national budget a little bit so that some centers can be reopened and these children can come to the continue in the education system. But then again, yes, it's difficult for me to speak for the government since they are not a signatory. It's I would say it's difficult for me to say that they have a future plan or anything.
I'd maybe ask a last question, inspired by a comment that was made. The person wrote, it might be interesting to extend analysis to refugee children with disabilities from the global south who find themselves in the global north. And I was wondering, apart from funding and donations, what could the global north do to support the global south in this situation?
I believe that there should be, the global north can really support these host governments. There are a number of things. One is the refugee countries, which are in, for example, South Sudan is constantly in civil war, internal conflict. So how the global community can support to improve that situation. And it's not easy. It's just not, it may sound like a statement, but it's not easy, but that's there. But given that reality, the global north can really have, support the host countries and there can be negotiations there. There can be longer term planning for repatriation in cases where there is no open door policy. In that case, the repatriation is expected. So in that case, the negotiation between the refugee country where the refugee population are coming from, in this case, Myanmar and Bangladesh, there should be negotiations there, like when repatriation can happen. But at the same time, there is a huge need for funding, and the host countries can really support in that regard. So there should be also negotiations done there.
Okay, we would have a last question. I just saw one come in, if you wouldn't mind. So the question is, are there excuse me for my pronunciation, but Rohingya refugees in Bangladesh? If so, are they treated differently?
They live in the refugee camps. They live in temporary spaces. So I would say that whether there is an intention to differentiate or not, there is a difference. They speak a different language, and they are not integrated in the national system. So this speaks for itself, for the situation there. But having said that, I think the host countries are providing enormous support. They have flexible policies for partners, NGOs to come and work in those spaces. They have developed systems within the government so that the distribution of resources within the refugee camps, it can happen smoothly. There have been dedicated camp managers, government officials who coordinate this entire system, because we are talking about millions of population coming from outside and living in one space. So of course the host country governments have dedicated a lot of resources in that regard, so that they can at least ensure the minimum for the basics for the refugee population, so that they can come and have a shelter, have food, nutrition, at least some access to education. So that those have been ensured by this host government, and that's a huge responsibility, I would say.
All right, so I would end our presentation, your presentation here, unless you want to add something, Dr. Rafiath, to close the meeting.
No, I would just like to thank you, Gabrielle and Rola, and CRIFPE team for having me here and giving me the opportunity to discuss and talk about a very important issue globally. And thanks to the University of Montreal, and thanks to all the participants who have asked very interesting questions, which I may not have answers to all the questions, but I just take those back, and I will keep thinking about those, and probably, we'll be able to in future. Probably you can come back and explore some of the questions together. Yeah,
absolutely. Thank you so much. I want to thank everybody who participated today, asked questions, or shared their comments about the presentation. I want to thank you on behalf of the CRIFPE and its research branch on inclusive education and the obstacles that we can be confronted with in school environments. So, je vais juste le traduire en français. Merci beaucoup à tout le monde. Je vous invite à rester à l'affût des prochaines présentations en lien avec l'éducation inclusive et ses enjeux en contexte scolaire au CRIFPE. On vous remercie énormément d'avoir participé, d'avoir posé vos questions et partagé vos commentaires. Puis, on serait très heureux et heureuse de vous revoir à la prochaine conférence. Merci beaucoup. Thank you very much. And thank you again, Dr. Rafiath, for this insightful presentation.
Thank you.
Thank you.
Thank you, everyone. Bye.
Have a great day.
A good day. Yeah.